Julie, I saw a case the other day. It was a case my resident had been seeing for a while. And so the owner says this, my dog gets into this position and she puts her hands down on the ground and the dog's butt is in the air. And I'm like, well, is the dog playing with you? She's like, no, he does it after he eats and he does it pretty much intermittently all night. And I was like,
Mhm.
you're at the wrong specialist, lady. Like
Mhm.
you're in the wrong place. So we run uh, CBC, chem, thyroid, GI panel, resting cortisol. We do a fecal DX plus Giardia. And this particular dog did come back with a cobalamin that was well over 1,000. I guess the machine doesn't measure too much
Yeah,
over 1,000, right?
right, right.
And so for this dog, I send to the nutritionist. For a long time, I learned in vet school that you send GI to the internist.
Mm.
Is there, but so many nutritionists have cured my patients that
Yeah.
present like this. What do we do? What do vets do in this situation?
Yeah, I love that question. Thanks for asking. So really it's tricky because there aren't enough nutritionists around. And so both internists as well as nutritionists manage a lot of GI disease, and sometimes we manage it together. And so some of it from a practical standpoint might be just availability. Do you have a nutritionist you can work with and do they have space? Or do you have a nutrition focused internist? And so again, we look for subtle signs too. The power for me is that history, both the medical and the diet history, give us those subtle signs. That sounds that praying position or whatever sounds like discomfort. It can be normal. I have a silly poodle that does that all the time, and that seems to be just her play. But it can be signs often associated with pancreatitis. And so I strongly encourage folks, and you don't have to be a specialist to do. I follow the AHA 2021 nutrition assessment, and there's a nice little table, and it's basically leveraging the efforts you're already doing. You're taking a history, you're doing a physical exam, and each one of they have some, sort of a checklist. And when there are abnormalities, that increases the level of risk where nutrition can have an impact. And so I do that mental checklist. And so is this patient losing weight? Subtle weight loss is so easy to overlook, but it's something that's simmering, and so I do that assessment and then review the current diet. And it's very easy to make some modifications and see if you see an improvement.